Greetings and welcome to Riverside Methodist Hospital. My name is Dr. Tom Bose and I am the Internal Medicine Residency Director. This presentation will describe the many important features and attributes of this program, and I believe will also answer many of the most important questions identified by applicants interested in an internal medicine residency training experience. Riverside is an independent academic medical center. We provide a unique hybrid model for both patient care and medical education, which combines the learning environment of a community hospital and the academic focus, facilities, patient volume, and subspecialty support services available only in larger tertiary care medical centers. We are a major teaching hospital with a demonstrated commitment to both graduate and undergraduate medical education. Riverside is affiliated with 4 medical schools here in the state of Ohio, through which we support a wide variety of 3rd and 4th year clinical rotation experiences. During this presentation, I will be describing the various topics relevant to our program as outlined in this slide. I'd like to take a few moments to describe the Riverside Hospital campus while emphasizing important details relevant to medical education and the residency training experience. All of the required inpatient and ambulatory rotations are completed on one campus. Our main hospital consists of 6 interconnected inpatient buildings supporting a census of 1,000 beds, with 5 critical care units, a comprehensive stroke unit, and a bone marrow transplant unit. Our freestanding ambulatory clinic supports the residents' longitudinal clinical experience and exposure to a variety of subspecialty clinics. The facility also supports resident education and documentation. This bird's eye view is intended to provide a better perspective of the Riverside Medical Campus. All of the colored buildings on this map, except the purple area, represent the interconnected hospital buildings. As you can see, the medical education office is centrally located on the first floor in the yellow building. On the northwest portion of our campus is the Riverside Community Medicine Clinic. As you can see, the residence clinic is a short 5-minute walk from the main hospital building. With an inpatient capacity of 1,000 beds, Riverside is one of the largest hospitals in the state of Ohio. The emergency department is the highest volume facility in central Ohio, and our 125 critical care beds supports our expanding role as a major tertiary care facility. Riverside is the 5th busiest single healthcare campus in the country. This patient volume provides our residents with the diversity and complexity of disease and pathology to enhance their clinical training experience. Our residents receive their ambulatory education and patient care experience in the Riverside Community Medicine Facility, which includes their longitudinal outpatient clinic and a variety of subspecialty clinics. Located just north of the residency clinic is the McConnell Heart Health Facility. This facility supports several specialty clinics, including sports medicine, bariatric medicine, and hyperlipidemia. A key feature of this facility is the comprehensive exercise center, which includes an indoor track, basketball court, exercise equipment, an indoor swimming pool, and rooms for dance and yoga. Residents are provided with a membership to this facility, which is open 7 days a week. The Graduate Medical Education Department at Riverside includes 9 independent ACGME-accredited residency programs supporting the education and training for 166 residents. Internal medicine is the largest of the Riverside and OhioHealth residency programs, with 60 residents, including 6 preliminary and 18 categorical residents per year. The remainder of the presentation will focus on the structure, function, faculty support, and many of the important attributes associated with our program. The remainder of the presentation will focus on the structure, function, faculty support, and many of the important attributes of the program. Support for the internal medicine residency program includes 14 associate program directors who represent our core faculty. We have 11 faculty advisors and over 120 teaching faculty representing ambulatory medicine, hospital medicine, critical care, and all of the internal medicine subspecialties. We have 3 chief residents and 2 full-time administrative consultants. The foundation of our residency program support is provided by our dedicated internal medicine core faculty. The 36 months of residency clinical rotation experience in this program includes 6 months of hospital medicine, 4 to 6 months of critical care medicine, and 12 months of ambulatory medicine, which is an ACGME requirement. These members of our core faculty serve as my chief advisors to support the residents' educational experience on the rotations in these clinical arenas. The residents' outpatient longitudinal clinic training is supported by 6 full-time preceptors, with 2 preceptors assigned to each of 3 longitudinal clinic teams. These faculty also participate in the didactics and also serve to support the program in the areas identified. These individuals are also members of our core faculty who serve as preceptors for some of the subspecialty clinics in community medicine, in addition to participating on the clinical competency and program evaluation committees and also supporting other components of the program. And finally, these important members of our core faculty support resident professional development, including research, scholarly activity, including both oral and poster presentations at regional and national conferences, quality improvement projects, and board preparation. Our 3 PGY4 chief medical residents are vital to the administration, operations, and educational experience of our residents. They create and coordinate clinical rotation schedules, resident vacations, and call coverage. They also facilitate the didactic conferences and the clinical simulation experiences that I will be further describing. For the past 7 years, our program has used the 4+2 curriculum schedule template, which alternates 4 weeks of inpatient or elective rotations with 2 weeks of ambulatory medicine throughout each academic year. The 6 weeks of night rotations for floor and ICU coverage are integrated into the 4-week inpatient blocks, and the vacation weeks are selected from either the ambulatory blocks or elective rotations. This curriculum design has also allowed us to adopt a team model for ambulatory care. The PGY 1-year curriculum is designed to provide each resident with a balanced clinical training experience, including ambulatory medicine, hospital medicine, critical care medicine, night float coverage, and a variety of selected key subspecialty consult service rotations. 22 weeks of electives or individual learning experiences are included. We offer both 2 and 4-week electives, and we support both away and audition rotations when desired. The 52-week academic year resident clinical rotation schedule is divided into 13 4-week blocks. The 4+2 curriculum is designed to allow each intern or resident to alternate 4 weeks of inpatient, night float, or an elective rotation experience with their 2 weeks of ambulatory medicine. In this example, intern B starts with a 4-week inpatient rotation on the hospital medicine service, followed by a 2-week block of ambulatory medicine in the resident outpatient clinic. The next 4 weeks include 2 weeks of night float and 2 weeks of an elective. Their second outpatient clinic block is then followed by a 4-week inpatient rotation experience in the intensive care unit. This slide outlines our entire 3-year clinical rotation curriculum structure. As you can see, each year incorporates rotational experience in ambulatory medicine, hospital medicine, critical care, night float, subspecialty consult services, and electives or individual learning experiences. 2 years ago, we introduced 4 clinical tracks to better align each resident's experiences and professional development during their second and third years of training with their post-residency career plans. The next few slides will concisely describe our residents' hospital medicine training experience. Our residents are provided with 4 complementary hospital medicine experiences. They rotate through the clinical medicine service in all 3 years of their training and on the COPC and Med 1 services in both their first and second years. There are no daytime hour admissions on either the COPC or Med 1 hospital medicine services, and all 3 services are capped at 16 patients to allow for a more optimal balance of service and education. The Accountable Care Unit service during the third year of training provides experience with a geographic-oriented unit model and provides residents with the opportunity to participate in daily multidisciplinary team rounds. A typical day on the hospital medicine services begins and ends with a structured handoff to ensure a continuity of patient care coverage. The morning hours are equally divided between time for pre-rounding and organized teaching and management rounds. Didactics occur daily Monday through Friday over the noon hour. We recently completed construction of a new dedicated conference room space in medical education to facilitate the important handoffs or transitions of care that occur between the daytime and nighttime primary services. Residents can also utilize this space during the course of each day for informal teaching or chalk talks as time allows. Our residents consistently identify night float medicine as one of their most impactful clinical training experiences. As previously mentioned, each resident completes 2 2-week blocks of floor night coverage each year. The hours are between 5 p.m. and 7 a.m. The floor night coverage team includes a senior and junior supervising resident and 3 interns. They are responsible for the teaching service coverage and admissions to those teaching services. They also provide code blue coverage outside of the intensive care unit. Along with night float, critical care also provides our residents with one of their more impactful training experiences. It also provides our residents with the opportunity to participate in a variety of invasive clinical procedures. Residents complete their required critical care rotation experience in one of our 2 medical intensive care units. This 30-bed unit is geographically divided to allow each of the 2 service teams to cover 15 patients. The coverage is designed to guarantee each resident 1 full day free of service every 6 days. I would like to spend the next several minutes briefly describing some important components of the critical care medicine experience at Riverside. One of the notable strengths of this program is the excellent opportunity we provide to our categorical residents to participate in a variety of invasive procedures under the direct supervision of either a credentialed supervising resident or an attending physician. By the end of their first year, our categorical residents typically complete 8 to 10 endotracheal intubations, 6 to 8 central venous catheter placements, and in some cases, hemodialysis or catheter insertion, and at least 6 arterial catheter placements. They also often have an opportunity to participate in either a thoracentesis or paracentesis procedure during their ICU experience. The residents also gain valuable ultrasound experience during their ICU rotation, using the point-of-care ultrasound Sonocyte machine to assist with both procedures and physical examination. Riverside provides for 24/7 intensivist coverage in both of our medical intensive care units. There are two intensivists assigned to each ICU for the daytime hours between 7 a.m. and 6 p.m. Each night, there is an attending physician intensivist covering the ICU to support the residents with new admission checkouts, procedures, and Code Blue supervision. Residents complete 6 assigned New England Journal of Medicine modules to complement their critical care learning experience. Didactic education at Riverside consists of 12 varieties of teaching conferences outlined on this slide, which are integrated into our morning and noontime conference schedule templates. Our morning conference schedule was recently modified to reduce conference fatigue. Residents in their first and second year on the inpatient rotations participate only in the Wednesday morning board review and the alternate week Friday morning grand rounds conferences. Senior residents participate in a senior board review on the second, third, and fourth Tuesdays of each week. Residents on their ambulatory blocks participate in ambulatory didactics during the morning hours on Thursdays. Our noontime conferences occur between 12:15 and 1 p.m. on Monday through Friday of each week. They include a variety of specialty conferences, generally provided on Mondays and Tuesdays, a weekly clinical case conference on Wednesday, and a variety of interactive conferences on Fridays. On Thursdays, those residents on their ambulatory block attend an ambulatory conference in community medicine, while those on the inpatient rotations attend either a diagnostics or high-value care conference. During our weekly one-hour case conferences, the residents work in teams to evaluate an undifferentiated patient presentation, construct a differential diagnosis, identify an appropriate diagnostic evaluation, and develop a treatment plan. The majority of our inpatient didactics occurs in the Gibbons Medical Education Conference Center, which was completed only 5 years ago and is for the exclusive use of our residents and medical students. It includes a large conference room for our morning and noon conferences, which accommodates up to 75 learners, an intermediate classroom where ClinMed daily teaching rounds occur, and smaller conference room for smaller groups of learners. The facility also includes a dedicated computer lab, which can accommodate up to 20 residents for independent learning and completion of documentation. Clinical simulation has an important role in medical education and is an area of emphasis in our residents' learning experience. The Simulation Training Center at Riverside is conveniently located within the main hospital and offers a wide variety of hands-on training experiences which allow residents with the opportunity to learn and enhance their clinical skills. As previously mentioned, our residents receive extensive experience in a variety of the commonly performed invasive procedures during their ICU rotations in the first, second, and third years of their training. The Clinical Skills Lab within the Simulation Center pictured here is used extensively during orientation and throughout the year to better prepare our residents for their procedural training experiences in the intensive care unit. A virtual care unit in the center provides clinical simulation for a variety of acute care medical emergencies, including GI bleeding, acute respiratory failure, cardiac arrhythmias, hypotension, and sepsis. The virtual care unit also supports weekly Code Blue simulation exercises, which allows residents and students to practice and enhance their advanced cardiac life support skills. The facility further supports our point-of-care ultrasound curriculum and provides simulation for doctor-patient communication skills, including end-of-life and goals of care discussions. Our point-of-care ultrasound curriculum was initiated several years ago and has continuously evolved with annual enhancements under the direction of our Associate Program Director for Hospital Medicine, Dr. Sanjay Patel. Our ultrasound curriculum incorporates didactic education to complement our simulation and live patient hands-on training. Our ultrasound instruction includes the use of our mannequin ultrasound simulator, as well as hands-on practice using a live model in the center. Ultrasound application is also now incorporated into bedside rounds on one of our hospital medicine teaching services and to support procedures on the pulmonary consult service and, of course, in the intensive care unit. The assessment and evaluation of a resident's performance are essential to their growth and professional development. I will take a few minutes to describe the evaluation process that we use here at Riverside. Our residents receive formative verbal feedback as well as written evaluations. The evaluations are confidential and are completed electronically following the completion of each rotation. Our evaluations are designed to be competency-based and include specific comments to identify areas of strength and areas for improvement. Each resident's individual evaluations are used to develop a semi-annual milestones report by the Clinical Competency Committee. The milestones report provides each resident with a profile to better understand their professional progress towards achieving proficiency in the 6 core competencies developed by the ACGME. Separate semi-annual meetings with the program director and the faculty advisor provide an opportunity for the resident to review and discuss this information and gain further insight into their strengths as well as their opportunities for improvement. This is an example of a small portion of the milestones report, which is used to describe a resident's level of achieved competence in 2 components related to patient care. Our governance structure is designed to encourage and support responsiveness to resident ideas, concerns, and suggestions for program improvement. At Riverside, we support and encourage resident input for program improvement. The Program Evaluation Committee is responsible for reviewing the program's areas for improvement and developing a plan to achieve these opportunities. This committee includes resident, chief resident, and faculty representatives. They solicit input from the resident inpatient and multidisciplinary outpatient shared governance committees, and also incorporate feedback obtained from the program and ACGME resident surveys. We place a strong emphasis on preparation for the American Board of Internal Medicine certifying exam, which includes dedicated faculty, a highly structured curriculum, and a carefully coordinated process. Program support for board certification preparation at Riverside includes a weekly board review conference which occurs on Wednesday mornings through the entirety of each academic year and utilizes questions from the Medical Knowledge Self-Assessment Program. Our senior residents also meet with 2 core faculty members on Tuesday mornings during their entire PGY3 year for senior board review. Our associate program director for board preparation provides each resident with a board preparation handbook, which serves as our homegrown Cliff Notes for the boards. And residents are provided with an annual $2,500 stipend, which can be used to attend a board review conference and/or purchase a board preparation question bank such as UWorld. Our residents are provided with the electronic version of the Medical Knowledge Self-Assessment Program, otherwise known as MICSAP. This program, developed by the American College of Physicians, serves as our program textbook. It includes core material, multiple choice questions, detailed explanations for the answers to those questions, and specific references, including general medicine and all 10 of the internal medicine subspecialties. Over the past 7 years, 100% of our graduating residents have successfully passed the ABIM board certification exam on their first attempt. Many applicants are interested to know where our residents go after graduating from this program. Over the past 2 years, our resident graduates have been almost equally divided between fellowships and hospital medicine. Among our current senior residents, 50% are planning to pursue a fellowship, 45% a career in hospital medicine, and 5% outpatient primary care. A 5-year retrospective review reveals that 60% of our residents have chosen fellowships, 32% hospital medicine, and 8% outpatient primary care. This portion of the presentation will outline the organized support provided for residents interested in pursuing a subspecialty fellowship and describe our program's fellowship match performance from a 5 and 10-year perspective. As a graduate of this residency program, who subsequently pursued and completed subspecialty training, support for fellowship preparation is a high priority. This support includes a dedicated faculty advisor coupled with a subspecialty faculty mentor to provide ongoing advice and direction, an associate program director for fellowship preparation, who is a former subspecialty fellowship director, and the opportunity to participate in virtual mock interviews. Our fellowship preparation also strongly emphasizes active participation and completion in scholarly activities, clinical research, and quality improvement projects. The following slides are intended to outline and summarize our fellowship match performance from a 5 and 10-year perspective. In 2019, 8 of our 13 graduates obtained fellowships, 5 of whom obtained the fellowship of their first choice. In 2020, we had 6 residents match into fellowships, 5 of whom obtained the program of their first choice. 7 of our program graduates in the class of 2021 obtained fellowships, 4 of whom obtained the fellowship of their first choice. 2 years ago, 4 of the 6 residents matching into fellowships obtained the program of their first choice. And this past year, 8 of our resident graduates obtained fellowships, 5 of whom obtained fellowships of their first choice. Over the past 10 years, we have matched 17 residents into cardiology, 4 into allergy immunology, 10 into endocrinology, and 4 into sleep medicine. The programs marked with asterisks indicate the number of residents from this program that have matched into that specific fellowship. The programs highlighted in turquoise represent programs into which our residents have matched in the past 5 years. Over the same 10-year period of time, we have matched 33 residents into pulmonary and critical care, 12 into rheumatology, 8 nephrology, and 3 simulation. The asterisks again indicate the number of residents from our program that have matched into that fellowship. And the programs highlighted in turquoise are programs into which our residents have matched within the past 5 years. And again, in the same period of time, we have matched 7 residents into hematology and oncology, 7 into hospice and palliative medicine, 3 into gastroenterology, 11 into infectious disease, and 3 each into geriatric medicine, sports medicine, and quality improvement fellowships. The asterisks again indicating the number of residents that have matched into that program, and the programs in turquoise representing the programs into which our residents have matched within the past 5 years. Internal medicine residency programs are required to provide their residents with formal training and clinical experience in quality improvement. At Riverside, our program support for quality improvement education and clinical experience is provided by one of our associate program directors and the recent addition of a third PGY4 chief resident for quality improvement. They have developed a curriculum for our PGY1 residents who also complete the IHI learning modules for process improvement. Finally, each of our residents is incorporated into one of 9 longitudinal project teams. Each of our 54 categorical residents are assigned to one of 9 quality improvement project teams. This year, 6 of the projects are aligned with outpatient quality metrics. 1 is related to procedural training improvement, and 2 represent areas for improvement in hospital falls and sepsis. An important part of our fellowship match success can be attributed to the strong scholarly activity support provided in this program. All residents are expected to participate in scholarly activity during their residency. This includes at least one case report for an oral or poster presentation at the Regional and/or National American College of Physicians annual meeting, one Grand Rounds presentation, and participation in at least one quality improvement project. Selected core faculty are provided with protected administrative time to direct, advise, and coach residents to achieve these goals. For each of the past 10 years, Riverside has been recognized as one of the top 3 programs in the state, based on the number of residents selected to present at the Ohio Chapter American College of Physicians annual scientific meeting, which is held in October of each year. At the American College of Physicians Ohio Chapter annual meeting this past year, Riverside residents presented 18 posters and provided 2 of the 4 abstracts selected for oral presentation. Our residents are also often invited to participate in national
oral
meetings,
and/or
such
poster
as the annual
presentations
American
at
College of
national
Physicians meeting,
conferences,
which is held in
including the
April of
American
each
College
year.
of Physicians, the American College of Chest Physicians, the American College of Cardiology, the American College of Gastroenterology, and the Society of General Internal Medicine. Over the last year, Riverside Medicine residents have provided over 60 presentations at national conferences, and 19 resident-authored abstracts have been accepted for publication in peer-reviewed journals. And finally, this is a summary of the scholarly activity in progress over the past 6 months. Our program emphasizes additional opportunities for resident professional development, including active participation on one of our hospital or residency program committees. Another unique opportunity for professional development which we offer is the Academy of Clinical Educators, which is an optional curriculum designed for those residents interested in becoming teachers as part of their career. This optional supplemental curriculum is available to up to 12 upper-level residents per year and includes the topics listed. We would be happy to answer further questions regarding this program at the time of your interview. I will conclude this presentation by outlining what we believe to be the strengths of this program. The strengths of the Riverside Residency Program include our dedicated faculty, who are available, accessible, and truly committed to resident education. Our excellent facilities, including the conference rooms and simulation center. Our culture, which is supportive of inquiry and emphasizes a growth mindset. Our residents, who provide a user-friendly, collaborative learning environment. And program leadership, which is responsive to resident feedback and has demonstrated a willingness to change. Our 4+2 curriculum is designed to provide for an optimal inpatient and outpatient training experience. Our clinical rotation tracks, which allow our residents to better prepare for their chosen career goals. Our didactics, which are both structured and interactive. Our clinical simulation, which provides for hands-on training experience. And our board preparation support, which has contributed to our outstanding pass rate. Our emphasis on resident scholarly activity, including support and ample opportunities for clinical research, as well as preparation for meaningful involvement in quality improvement projects. Procedural skills, including training and supervision, leading to extensive opportunities for hands-on experience. Our ultrasound program, with dedicated, experienced faculty and an organized curriculum that also emphasizes hands-on experience. Fellowship preparation, with organized support, leading to a track record of well-demonstrated success. And finally, our new Academy of Clinical Educator pathway, which provides residents with the option to be involved with an innovative longitudinal curriculum to prepare them to become teachers in their subsequent professional career. Thank you for your interest in Riverside. I hope this presentation answered many, if not most, of the important questions that you have regarding this program. I wish you the very best in the upcoming interview season. Please be sure to review the separate brief presentation outlining the important details of the Riverside Interview Day experience.